In 1981, an international symposium was held in Japan, which mainly dealt with hormones controlling the metabolism of calcium. Among the lecturers were Dr. Harold Kopp of Canada, who discovered calcitonin, and Dr. Hajime Orimo, who found L Calcitonin. Studies on the metabolism of calcium are attracting attention throughout the world, mainly due to the increase in bone disease in recent years. This film illustrates the pharmacological action and therapeutic effect of L Catonian, which regulates the metabolism of calcium. Distribution of calcium in the body. We take 500 to 1,000 milligrams of calcium daily through eating and drinking. Let us follow the distribution of calcium in the body when 1,000 milligrams of calcium was ingested. About 350 milligrams is absorbed by the intestine, and the rest is excreted in feces. Part of the absorbed calcium is secreted in digestive fluid and again excreted into the intestine. Excluding the reabsorption, it is estimated that 250 milligrams is eventually excreted into the intestine. Therefore, a total of 900 milligrams of calcium is excreted daily in feces. Calcium which entered the blood is excreted into urine. In normal humans, the calcium intake and excretion are almost equal, and the calcium balance in the body is maintained. Normal calcium metabolism is maintained by the harmonious functions of the intestine, kidney, and bone, which function as the intake, outlet, and reservoir of calcium respectively. Now let us observe how calcium in the blood goes into the bone by means of scintigraphy using radioactive technetium. The intensity of radioactivity is shown in brightness. Technetium is excreted from the kidney into the bladder. The remaining technetium is gradually taken up by the actively metabolizing bone, and the image of the bone becomes distinct on the screen. Now let us observe the structure and function of the bone. A longitudinal section of the bone. The bone is composed of cancellous and compact bones. Cancellous bone is composed of the trabeculae running in a fixed direction. Bone marrow fills the space between trabeculae. Under the microscope, thin canals are recognizable in the longitudinal section of the compact bone. We can see Haversian canals running longitudinally, and Volkmann canals connecting the Haversian canals. Capillary vessels are found in the Volkmann canals. A cross-section of compact bone. The concentric circular areas are called osteons. The central hole is a Haversian canal, which is surrounded by osteocytic lacunae. Osteocytes are found within the lacunae. Compact bone seen with the polarization microscope. Minerals forming the bone present colorful patterns. Under magnification, round dents are found in the bone tissue here and there. These are called resorption cavity, in which are found multinuclear osteoclasts. In the trabeculae, osteoblasts involved in bone formation are recognized as arrowed. The dots show the site of advanced calcification. In the bone tissue, the resorption by osteoclasts takes place in connection with the formation by osteoblasts. Thus, the calcium balance in the body is maintained. Next, we'll observe the behavior of bone cells by tissue culture. Isolated bone cells migrate from the cultured calvaria of mouse. They include osteoblasts, osteoclasts, and macrophages. Osteoblasts, having numerous granules within the cell wall, are taking in nutrients by pinocytosis, changing the cell membrane. An osteoblast changes its form with the passage of time and eventually turns into an osteocyte having many long projections. This resembles the image of an osteocyte seen with the scanning electron microscope. And this is a scanning electron microgram of osteocytes. Long projections feature the cells. These cells are firmly interlaced with one another with the projections inside the bone tissue. Some cells are moving about in the culture, drastically changing their shapes. Smaller ones appear to be macrophages. Some larger ones are multinuclear cells. This is an osteoclast. This cell is round and its membranous change is quite characteristic. What will happen if osteoclasts are brought into contact with bone powder? The culture medium contains PTH, a hormone accelerating bone resorption. 4 hours after the contact with bone powder, cells begin to take in bone powder. They gradually absorb the bone particles taken in, carrying them towards the nuclei. The metabolism of calcium is controlled by bone resorption, bone formation, and by 3 hormones regulating them. One of the 3 is PTH, a hormone secreted by the parathyroid gland. Secretion of PTH is regulated by the level of serum calcium. More PTH is secreted when the calcium level lowers. PTH increases the serum calcium level by the following process. First, it acts on the bone and accelerates bone resorption, by which calcium is released from the bone and enters the serum. PTH also acts on the kidney to control excretion of calcium and phosphorus. It accelerates reabsorption of calcium in renal tubules and decreases calcium excretion into urine. On the other hand, PTH inhibits reabsorption of phosphorus and increases its excretion into urine. It stimulates the excretion of cyclic AMP into urine. PTH also has the function of increasing the production of 1,25-dihydroxy-D3 in the kidney. The second hormone is 1,25-dihydroxy-D3. Vitamin D3 is taken in through food, while its precursor is converted to 1,25-dihydroxy-D3 in the skin by the action of ultraviolet rays. Vitamin D3 in the blood enters the liver, where its 25th carbon is hydroxylated by an enzyme. Then it reaches the kidney, where 3 types of active vitamin D3 with different positions of hydroxyl groups are produced. One of them is 1,25-dihydroxy vitamin D3, which is now considered to be a new renal hormone rather than a vitamin. Production of 1,25-dihydroxy-D3 in the kidney increases under the influence of PTH when the level of the serum calcium lowers below normal. In the first place, it accelerates reabsorption of calcium in the renal tubules. It also increases reabsorption of phosphorus. Phosphorus in the serum is one of the controlling factors of 1,25-dihydroxy-D3. 1,25-dihydroxy-D3 stimulates bone resorption. At the same time, it accelerates bone formation, thus curing rickets. Lastly, the most important action of the hormone is the stimulation of gut absorption of calcium from food. Thus, 1,25-dihydroxy-D3 increases serum calcium by acting on the kidney, bone, and intestine. The third important hormone regulating the metabolism of calcium is calcitonin. It was discovered in 1962 by Dr. Kopp of Canada and co-workers. In those days, they were engaged in studies on the regulation of serum calcium in dogs. When they perfused high calcium blood through the thyroid and parathyroid glands, they happened to notice the fall of the calcium level in the peripheral blood. They named the substance responsible for this phenomenon calcitonin, which they believed to be secreted by the parathyroid gland. In 1963, Dr. Philip Hirsch of the United States and others found that the substance was in fact secreted by the C cells in the thyroid gland and named it thyrocalcitonin. These are C cells of the thyroid tissue in culture. Embryologically, the C cell is derived from the neural crest. It is distributed in the thyroid gland in mammals, but exists in the ultimobranchial body in lower animals. As a result, the prefix thyro has been dropped, and we usually refer to the hormone as calcitonin. C cells clearly shown by means of a pass stain. C cells seen through an electron microscope. Granules of calcitonin look black in the cell. Since the determination of the primary structure of porcine calcitonin in 1968, those of 8 others have been known to date. Calcitonins are polypeptides, each consisting of 32 amino acids, whose first and seventh are connected with an SS bond, and whose C-terminal is proline amide. The 9 types of calcitonins are subdivided into 3 series: the porcine, human, and salmon, according to the arrangement of the amino acids. Eel calcitonin is similar to salmon calcitonin type 1, except for 3 amino acids. The physiological activity of a calcitonin is generally evaluated by its hypocalcemic effect in rats. Generally speaking, calcitonin from fish are more potent than those from mammals in its activity, and eel calcitonin has the highest activity among those of fishes. Now let us observe the secretion and physiological action of calcitonin in living organisms. Secretion of calcitonin is regulated mainly by serum calcium and the gastrointestinal hormones. Its secretion is known to be stimulated by hypercalcemia. The target organs of calcitonin are bone, kidney, and intestine. In the bone, it inhibits bone resorption and accelerates bone formation. As a result, it inhibits the mobilization of bone calcium into blood and lowers the serum calcium level. In the kidney, it inhibits reabsorption of calcium in the tubules and stimulates calcium excretion into urine. Similarly, it stimulates the urinary excretion of phosphorus. In the intestine, it mainly inhibits calcium absorption by the small intestine. Now let's review the history of the research and development of eel calcitonin and its derivative, L Catonian. In 1972, Dr. Hajime Orimo and co-workers found that a substantial amount of calcitonin was contained in the ultimobranchial body of the Japanese eel. In the eel, calcitonin is secreted from the ultimobranchial body located around the esophagus just below the pericardium. This is the ultimobranchial body of the eel. The secreting cells are shown with dotted lines. The inside forms lumina. Isolation and purification of calcitonin from the eel was performed by Dr. Susumu Watanabe and co-workers, and its primary structure was determined in 1976 by Dr. Kozo Narita and others. For this work, 200 kilograms of organs, including ultimobranchial bodies, esophagi, and pericardia from 1 million eels were used. As a result, 3 milligrams of pure eel calcitonin was obtained. It soon became apparent that the biological activity of L-Calcitonin is unstable because of the existence of an SS bond between the first and seventh amino acids. Moreover, its synthesis is difficult. Then Dr. Shunpei Sakakibara and co-workers succeeded in synthesizing a calcitonin derivative in which the SS bond was replaced by a CC bond. The substance was named L Catonian. It has since been demonstrated that L Catonian has exactly the same physiological action as L-Calcitonin, and that it has stable biological activity. Thus, thanks to the effort of many researchers, L Catonian was created to open the way for the clinical use. L Catonian is the only calcitonin preparation developed in Japan, and it is now enjoying global attention. Next, we'll study the effect of L Catonian on bone by means of tissue culture. Radioactive calcium, calcium-47, was injected into a 3-day-old mouse, and 24 hours later, its calvaria was removed for tissue culture. After a certain period of culture, bone resorption is assessed by counting the radioactivity of calcium-47 released into the medium. To the culture medium, PTH, 1,25-dihydroxy-D3, prostaglandin E1, and an osteoclast activating factor were added. They stimulate bone resorption. When L Catonian was added to the culture medium, the acceleration of the bone resorption was significantly inhibited. This graph shows the result. L Catonian had a marked inhibitory effect on bone resorption in vitro. Now we'll observe the effect of L Catonian on bone cells. This is a culture of normal bone tissue. Bone cells are moving inside the lacunae of the calvaria. Comparatively thick collagen fibers are seen in the middle of the lacunae. Round cells have gathered on the bone surface. Actively moving small cells are macrophages, and the big, roundish ones are osteoclasts. These are magnified. Osteoclasts are seen adhering to the bone surface. We can also recognize mononuclear osteoclasts. Next, we'll see how the bone cells change when PTH is added to the culture medium. Osteoclasts attach themselves to the surface of the bone tissue and begin to invade into it. In this sequence, 1 second stands for 30 minutes of the actual phenomenon. Gradually, the resorption cavity increases in size. This time, 1,25-dihydroxy-D3 is added. It appears that 1,25-dihydroxy-D3 potentiates the cell activity. Bone resorption is accelerated, and the resorption cavity above and below the cells are gradually enlarged. Then L Catonian is added to the medium containing PTH and 1,25-dihydroxy-D3. Osteoclasts are seen separating from the bone surface by the effect of L Catonian. We then looked at the effects of L Catonian on bone resorption. Bone tissues were daily treated with PTH alone or with PTH plus L Catonian for 3 weeks. In the bones treated with L Catonian, bone resorption was significantly inhibited. Thus it was shown that L Catonian had a potent inhibitory action on bone resorption in vitro. Recent studies indicate that L Catonian also stimulates calcification and bone formation. When diphosphonate or EHDP is given to rats, impairment of calcification of the epiphyses of their tibiae occurs. If L Catonian is administered to such rats, the impairment is inhibited. As shown on the right, L Catonian administration has clearly inhibited the impairment of bone calcification. This result suggests that L Catonian stimulates calcification and formation of bone in vivo. Next, we'll examine the pharmacological action of L Catonian in experimental animals. First, the effect of L Catonian on hypercalcemia is evaluated. VX2 tumor, a highly malignant but undifferentiated carcinoma, is inoculated in rabbits' tibiae. Then cancer cells proliferate and give rise to hypercalcemia. L Catonian is administered to the rabbits from the second week of inoculation. This graph shows the change in serum calcium. The serum calcium level in the control group rose in the second week, while that in the L Catonian group was significantly lower. These are the bones of rabbits carrying VX2 carcinoma. Bone resorption is shown as dark images. As shown in the right, bone resorption is clearly inhibited by L Catonian, in contrast to the control group shown on the left. Next, let us look at the preventive effect of L Catonian against experimental osteoporosis in rats. Rats fed on low-calcium diet develop osteoporosis when they are given prednisolone. L Catonian was given to the rats with osteoporosis, and its effect on the bone was evaluated by a fracture test. This picture illustrates a torsion fracture test on the rat bone from the control group. Bone is broken down in about 0.1 second. The same fracture test is shown by high-speed photography. The bone strength is expressed in terms of the torsion angle and torque at the yielding point. The greater the curve gradient and the area below the curve, the stronger the bone is. The test has shown that L Catonian improved the bone strength almost up to normal. Finally, let's think about the present status and prospects of the clinical use of L Catonian. This table summarizes the suggested clinical application of L Catonian. Hypercalcemia occurs due to various causes, and L Catonian is effective against any of them. This is a skeletal scintigram of a hypercalcemic patient with multiple bone metastasis of carcinoma. Radioactivity is concentrated on the affected parts of the bone. This graph shows the changes in the serum calcium level after the administration of L Catonian in 28 cases of malignancies and 14 cases of primary hyperparathyroidism. The efficacy of L Catonian was shown in almost all the cases. Next, we'll take up Paget's disease of the bone. It is characterized by bone pain and bone deformities due to excessive localized bone resorption and formation. This skeletal scintigram shows pronounced concentrations of radioactivity on the morbid part of the bones. This is another patient. The parietal bones are thickened, showing a typical cotton wool pattern due to the mixture of osteosclerosis and osteolysis. This graph shows cases of Paget's disease of the bone treated with L Catonian. Marked improvement of bone pain, reduction in the uptake of technetium tracer in the bone, and the decrease in serum alkaline phosphatase was noticed following the administration of L Catonian. The TBE of another patient are compared before and after the treatment with L Catonian. As shown by the arrow, the bone was apparently improved. Thus, L Catonian is effective against Paget's disease of the bone. Now let us look at the effect of L Catonian against osteoporosis. Generally, osteoporosis is a disease common in aged women and characterized by the loss of bone mass and by the clinical symptoms such as low back pain and pathological fractures. Normal and osteoporotic cross-sections of the vertebrae are shown. Loss of bone mass is apparent in the osteoporotics. Osteoporosis is now recognized as an important disease due to the increase in the aged population. Osteoporotic patients tend to complain of low back pain, and L Catonian has been shown to be effective in removing such pain. This is the result of a recent double-blind study on osteoporotic subjects complaining low back pain. A significant improvement was shown in the L Catonian group in contrast to the placebo group. Osteoporosis is often accompanied by the pathological fractures, such as compression fracture of the vertebral body, cervical fracture of the neck of the femur, and fractures of distal radial ends or ribs. This is a case of a 79-year-old woman with fracture of the neck of the femur. This kind of fracture is difficult to cure, and often osteoplasty is performed for such cases. Now, L Catonian is being used to increase the bone mass and to prevent pathological fractures. Recently, due to the prevalence of dialysis, cases of renal osteodystrophy, which is characterized by bone rarefaction, bone pain, and pathological fractures, are becoming more popular among the patients with chronic renal failure. L Catonian is expected to be useful in the treatment of such cases. In addition, L Catonian is known to act on the alimentary tract, kidney, central nervous system, and has an anti-inflammatory effect. It is expected that L Catonian will find more applications in accordance with the future progress in the basic research.